My pleasure, and apologies. I don't know what button I pressed, but you saw a very messy computer desktop, which sadly is very analogous to my work desktop as well. I do apologize. Anyway, we're back on target now and talking about a topic that is really dear to my heart because kidney problems are very, very common, particularly in our elderly cats. But there is a lot of good news about kidney disease now, a lot of good things to say because there have been many, many advances in our understanding that have contributed now to us getting much greater results in terms of survival of cats with this issue. And so any of you that are listening that do have cats with kidney problems, firstly, of course, you have my sympathy, my empathy for dealing with this situation, but I hope that there will be lots of positive things that you'll be able to take out of this presentation and that will help you in the management of your cat. So over the next 25 minutes or so, what I'm going to do is really work my way down this list and talk a little bit about healthy kidneys, where they are and what they do, before I concentrate really on the main cause of kidney problems in cats, which is a condition called chronic kidney disease. And you'll see I've abbreviated that to CKD on the slide. So we'll talk about what we mean by this term CKD, what causes it, how we diagnose it, what the consequences are of CKD, how we treat it, and what sort of results we can expect to see in our patients. So firstly, everyone I'm sure is aware that we and animals all are born with two kidneys, and this is an X-ray of a cat's abdomen, and the cat is lying on its side, and at the top of the picture you can see the vertebral column, so the bones of the backbone. And just below there, in the middle of the picture, is where the kidneys sit, and I'll just make that area a little bit bigger now. So we have two kidneys. They actually more or less on top of each other in this view, but one on each side, a right kidney and a left kidney, and they have this bean-like shape, which is a sign of a nice healthy kidney in this cat's situation. So what do kidneys do? Well, they are actually very, very complicated organs. They perform a lot of very important functions which are vital to our patients' survival. So firstly, they produce urine, and that is a liquid which is excreted from the body. And that liquid urine contains a lot of things that essentially the kidneys are excreting for the body. So that includes products of protein breakdown, including substances like urea and creatinine, which I'll talk a little bit more about later. But also the kidneys excrete drugs, toxic substances, and a number of hormones into the urine. The kidneys also are very, very involved in regulating all sorts of other body functions. So, for example, they help to maintain normal hydration, so prevent dehydration from occurring. They also help to manage the blood levels of various salts, substances like sodium, potassium, calcium, and phosphate, for example. They also help to control how acidic the blood is, and this needs to be regulated in a very tight, very narrow boundary, so the kidneys are very important for that. They also are involved in regulation of blood pressure, and lastly, a number of hormones that are actually produced and or activated by the kidneys. So a huge number of functions which a normal, healthy kidney is performing all the time in our body. And so we can see quite easily that if any of the kidney function is damaged, there can be a lot of different consequences that we need to worry about in our patient. So what is chronic kidney disease? CKD is the term that we use now. And we use this term rather than actually nowadays talking about renal failure or kidney failure, and also we no longer really talk about renal insufficiency or kidney insufficiency. These terms may be familiar to some of you listening, because traditionally we used to talk about insufficiency being the first stage of kidney disease and then failure being the point at which clinical signs of illness became apparent. So the consequences of that kidney disease becoming apparent to an owner, for example. But now we actually talk about the two together and we just call it chronic kidney disease. It's a less emotive term, which I think is good, because many cats that you would have classified as being in kidney failure actually can be stabilized for years with a very good quality of life. So the term failure is, I think, unnecessarily emotive. It puts a very depressing sort of slant on the disease, which is not needed. And what we mean by a definition of chronic kidney disease is that there has been a decline in the function of the kidneys, so that there are two main outcomes. The first is that the cat is no longer able to produce urine that is concentrated. And cats have adapted and evolved from being desert-dwelling creatures. So in the normal healthy cat, they produce a very small volume of very concentrated, very strong urine every day. If they have damage to their kidneys, they lose this ability to produce concentrated urine, and the urine is much more watery, more dilute. And the cat, unfortunately, is more vulnerable to becoming dehydrated. The second major problem in a cat with chronic kidney disease is that their kidneys are no longer able to perform adequate excretion of all of those things which the body needs to get rid of. So the protein breakdown products, the toxins, the hormones are no longer being adequately excreted by the body. There are lots and lots of different things that can cause chronic kidney disease, and in fact in many of our patients we don't ultimately know what has caused the kidney disease, because by the time we make that diagnosis what has actually caused the damage to the kidneys has long since gone. But just to give you an example of a cause of chronic kidney disease, which you may or may not be aware of, one example would be a congenital condition, a condition which the cat is born with, called polycystic kidney disease, or PKD. Sorry about all the acronyms. And this is a condition which is particularly common in Persian cats, hence having a picture of a Persian cat on this slide. It's an inherited condition and actually caused by a dominant gene. And cats that carry this gene will actually develop polycystic kidney disease. When they're born, the kidneys appear to be relatively normal, but they have very small, microscopic sized cysts within them. And these cysts are little fluid-filled structures that, as the cat gets older, gradually enlarge, putting pressure on the healthy tissue around them and effectively killing off that healthy kidney tissue. And ultimately, that is an important cause of kidney disease in that cat. And typically, the kidney disease doesn't arise until the cat's middle-aged or even slightly older, by which time that cat may well have bred and passed its genetic defect on to another generation. So it is something that unfortunately is still quite common in the Persian cats, although many Persian breeders now are making great efforts to eliminate this disease through selective breeding, because it's now possible to actually test cats for this condition before they start their breeding cycle. And the ultrasound pictures on the bottom of this slide show, firstly on the left-hand side, what a normal kidney looks like on ultrasound. So again, hopefully you can appreciate it's broadly a bean shape, and there are two layers to the kidney: the outer cortex, which is a little bit grayer, and then the medulla, which is a little bit closer to black in color. So where I have my arrow now, if you can see that, is on the medulla. In the right-hand side image, the one labeled PKD, that is still a kidney, believe it or not, but instead of seeing a normal kidney structure, we can see these black circular structures which are cysts throughout that cat's kidney, and there's very little normal kidney tissue left behind, which means that this cat unfortunately was suffering from the consequences of kidney disease. In most of the cats that we see in our clinics with kidney disease, they actually have acquired causes of their kidney disease. So they were born with healthy kidneys but have subsequently developed problems as they've grown older. And couple of reasonably common examples listed on the slides there. So chronic tubular interstitial nephritis, which is often an end stage to many renal insults. So for example, if the cat's had an infection in the past or perhaps been exposed to a toxin, for example. Pyelonephritis is a bacterial infection affecting the kidneys. So how do we diagnose kidney disease? Well, as vets, usually when we come to making any diagnosis, there are three main stages that we go through. And the first is to look at what we call the history and the clinical signs, but what you would probably consider are the symptoms. So what clues of illness have there been from the cat at home? Secondly, the examination of the cat in the consulting room, and lastly, laboratory tests, which are usually required to confirm our diagnosis. And this slide lists some of the common clinical findings in cats with kidney disease. And what you can see, and what I've outlined at the top, is that in fact the most common clinical signs, so the most common symptoms, if you like, are completely vague and unhelpful. So dehydration, loss of appetite, lethargy or depression, and weight loss are the most common signs of kidney disease in a cat. And these clearly are also clinical signs that you would see with many, many other illnesses. So that's a little bit of a frustration for us as clinicians, because it means we need to consider kidney disease much more commonly than it exists to make sure that we don't miss cases. Many owners often think of an increased thirst as being an absolute hallmark of kidney disease, and that is right to some extent, although there are other conditions that can increase the thirst and that are also common in older cats, examples being diabetes mellitus and hypothyroidism, an overactive thyroid gland. And also for many cats, actually it's difficult to know how much they're drinking. They may drink from sources outside the house, for example, so a change in thirst might not be spotted. And indeed, because cats have adapted from being desert-dwelling creatures, their kidneys are very, very good at conserving fluids, even when they start to become diseased. So an increase in thirst may not be seen until the disease is actually quite advanced. From a veterinary perspective, in the consulting room, there's lots of things that we would routinely want to do. One of the few situations where we can probably be quite certain of a diagnosis actually over the consulting room table. We also very importantly want to look at hydration. Is our patient dehydrated at all? Is there any evidence of anemia? And this picture of a cat on this slide, hopefully you can appreciate that poor cat's nose is very, very pale. And this is because this cat was very anemic. He had very few red blood cells. And so his gums were white as a sheet, and his nose was also quite white. And then lastly, what I put on this slide is it's important for us to always consider that a cat with kidney disease may have high blood pressure. About a fifth of our cats with kidney disease actually do have increased blood pressure, and this can be extremely serious to the cat. And one of the things it can do is cause bleeding into the eye and detachment of the retina. And that's something that we can see on an eye examination.